On that day when I got up, it was, kind of a rainy day, but it was gonna be a beautiful day. Never expecting that the hurricane would decide to park over us and dump records amounts of water.
I was at a meeting at Johnson City Medical Center and had been texting back with my team to see how things were going. And I got in contact with the facilities manager, and the decision had been made to evacuate based on the data that was provided by the emergency management agency in Unicoi.
And so we were all making phone calls to make sure we had the resources at the hospital we needed to get the patients out. And then also putting our swiftwater teams on standby. And so Washington County did an amazing job making sure that we had those teams ready to go if we needed them, and unfortunately we did need them.
So we started loading patients into ambulances, and the access road in the front was took out. So we realized we couldn't get patients out by ambulance. So we brought the patients back, and we put everybody back into the emergency department because at that time that was the safest area.
The water just kept rising and rising. Next thing you know, it's coming into the hospital. It's at our ankles. And then, oh my gosh, next thing you know, it's mid-shin. We needed to get onto the roof. The water was coming in so quickly, we were unable to access that staircase because there was a current in the hospital. And you've seen the movie The Titanic, I'm sure, where there's rapids in the hallways. That was what was happening within the hospital.
I don't remember being concerned for myself. I just was really concerned that the team was at risk and that our patients were at risk. We
were able to utilize ladders that were on the fire truck that was stranded with us to gain access to the roof. We were out in the elements. A lot of us had sunburns, from being up on the roof. The winds were about 40 miles per hour at times, and so there were windshields up there that we were actually hunkering behind. We were up there for a couple hours. And it's not because people didn't want to come save us, but the situation was so dire, no one could enter our location via water.
When there was nothing else we could do, I just kept thinking in my mind that helicopters have to come get us. That's the only thing that can get us off this roof. The amount of debris and the way the water was rising, and like I said, it was rapids. I started being uncertain how long the building would take the beating that it was getting.
The amount of risk that was there, homes floating down the river, trees penetrating through the hospital, it was not lost on the team members and the rescuers. And so a lot of phone calls went out from that roof to touch the hearts of our family members, to let them know that, we loved them. And, we were doing everything we could. Ballad Health was doing everything they could. The state was doing everything they could. And just to be strong and send love and pray for us while we were there.
One of our nurses led prayer on the roof, which was, good for the team as well.
People in Southwest Virginia, East Tennessee, we're bound by our heritage. And when we were able to hold hands and share that moment, it was something that calmed the entire feeling on the roof. The pilots did an amazing job deciding to kind of hold off for a little bit until the wind died down, and then as soon as it died down, they entered in, and those helicopters ascending down, you could just hear the claps on the roof, and people were elated. They were excited.
Just the relief and how thankful I was to the Lord that I knew, we were going to be rescued, and the helicopter teams were amazing.
And thankfully that day, everything happened in a way that it was supposed to.